Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and you know that I have a little segment on my YouTube channel called A Great Little Case. I'm going to show you a great little case, and this is a patient who had a brow lift, upper eyelid surgery, lower eyelid surgery, cheek implants, chin implant, full face laser, and a face and neck lift. So that's pretty much my meat and potato type surgery. Some patients have one procedure at a time, and other patients want to get it all over at one time. So I'm going to show you some before and after pictures and walk you through this neat little case. I'm Dr. Joe Niamtu, LoveThatFace.com.
Okay, so we're going to talk about this great little case, and this is actually, when I say little case, we actually did a lot of procedures here on this patient. We did a brow lift, upper eyelid blepharoplasty. We did cheek implants and a chin implant, face and neck lift, and laser skin resurfacing. So this is a good example of multiple procedures to address the upper third of the face, the middle third of the face, the lower third of the face, and the skin. So this is a 63-year-old female, and she's shown about 9 days after her surgery. At this point in time, her skin is still peeling from her laser, and if she would use a washcloth on that, it would all come off. And so, considering the number of procedures that the patient had done, she is healing quite well as she nears the 2-week mark after her surgical procedures. So this patient is shown here approximately 90 days after her surgery. And if we break the face down into upper third, middle third, lower third, and then skin, we'll analyze what we've done. So if you start at the top and look at her brow lift results, you can see number one, that in the before picture she has deeper lines, which are improved after the brow lift. You can also see that her brows are naturally elevated, and again, this is a very subtle elevation. Nothing looks worse than an overdone brow lift. The patient's left eye has some ptosis, as it does in the preoperative picture. She was not interested in having this repaired, period. And basically you can see the improvement of her upper eyelid surgery as well. If you look at her skin in general, you can see improvement of her pigmentation in the before and after picture, in the increased youthful quality of her skin. And again, in Middle Eastern skin, you have to be very cautious how you laser, so this is a pretty light laser. Looking at her midface, you can see how her cheeks have added youthful volume from the cheek implants. And looking at her chin, again, you can see how this has tapered her face. And the face and neck lift, if you look at her jawline, it is a much more youthful oval jawline from the more aged square jawline she had preoperatively. Finally, if you look at her neck, you can see that there were loose skin and platysmal bands preoperatively, and now these have been corrected by the facelift. Let's look at some other views as well. So this is a right 3/4 view, and again, we'll start at the top. We'll notice the improvement of the forehead lines, the subtle elevation of the brow. Looking at the skin in general, you can see that the laser has improved the pigmentation and smoothed the skin and given her a better glow. You can see what the cheek implants and the chin implant are doing here, and also how we have improved the patient's jawline contour and her neck contour with the facelift. The patient did develop a small lesion on her neck that you can see in the after picture that was subsequently treated. Now looking at the right lateral view, again, look at her forehead, her brow elevation, the improvement of her cheek contour. We have given her more chin with the chin implant, and I think it's pretty obvious to see the improvement of her jowls and her neck skin. And then again, looking at the patient's postoperative skin, you can see that the laser did add value to this case, and the patient is very happy. And again, just another view of the patient. We'll start at the forehead, look at the improvement of the wrinkles, which is largely from the brow lift and somewhat from the laser resurfacing. Again, notice the difference of the subtle brow lift. The cheek and chin implant contributions to the case. You can really see how nice the chin improved this patient's profile in this view. And looking at her jawline and neck, you can see the significant improvement from the facelift. And once again, looking at her skin before and after the laser, you can see that improvement as well. This view, in addition, illustrates the changes that we have been discussing here. And I think from the side view, you can really appreciate what the chin implant does and what the facelift does. If you look at her profile in general, her chin and the improvement of the projection in the post-surgical picture, her jawline improvement, and the significant improvement of her excess neck skin. And again, our goal, you might look at this and say, well, the patient still has some smile lines or nasolabial folds. And again, we want age-appropriate improvement. We're not trying to make this patient look like she's 20, and that's when people look odd or false or have that kind of done look. We just want to make this patient look as good as she can for her age, and she's very happy, and we have achieved that goal. The scars that a patient are left with are basically the signature of the surgeon, and I pay so much attention to the way I make my incisions and treat my post-surgical scars. Now, any patient with pigment in their skin, and this patient is Middle Eastern descent, sometimes they have a little thicker scar. It takes a little longer to heal, but I think you can see on the picture on the right that her scar is healing great. It's still a little bit pink, and after several months, I don't think you would even notice that there was a scar there. And again, the same thing in the other side. You can see that there is a little pinkness, but we've had minimal changes to the surrounding anatomy. Her tragus is normal and her earlobe is in normal position. So it's really exciting to be able to do this type of surgery and make these kind of changes and make happy patients and make people that are older look younger. I'm so lucky to be able to do what I do. That's why I get excited about going to work. And if you follow our channel, you know that I really have a passion for this. And I'm just so glad to be doing what I do. I'm also really lucky to have developed such a international practice over the last 30 years. Facelift surgery is my passion and all the things that go along with it, including eyelid surgery, facial implants, laser, brow lift, and some of the procedures that I have shown you. My website is lovethatface.com, and if you're considering having cosmetic surgery, we can make it safe and easy for you. We see people from all over Virginia, all over the United States, and a respectable number of international patients. And again, I just love what I do. Check out our website, lovethatface.com, and thanks for the best gift of all, which is your time. I'm Dr. Joe Niamtu.